I love this one from Martin. Better understanding why there has been a rise in the diagnosis of ASD, or is there actually, what is driving? We saw the CDC recently came out and said now 1 in 44 individuals in the US have been diagnosed with autism. So anything you can share about that would be great.
Absolutely. So the research seems to show that there are a couple of things that are leading to the rise in the number of diagnoses. The first one really is we're looking for it. So way back in the day, autism used to have a very, very narrow definition. And again, there wasn't as much knowledge about the many different ways that autism can appear. And so many people thought, again, of more classic presentations or more severe presentations. And as we studied the ASD and just again, how many different individuals can present, there was a better understanding of, again, the fact that there are neurological underpinnings that can help us understand how this manifests in many different ways. So part of it is that we're better able to look at the subtleties. Another part of it is because there was a recognition of how important early intervention and early diagnosis is, we screen basically everyone now. So there are universal screenings that are mandatory in California, where you are the children are screened at every single well visit, and there was again a larger number of children that were being referred for evaluations and for services. So not just autism, but other developmental delays, language delays. We are doing a better job also of treating providers to listen to parents. Because a lot of times parents would come to a provider and they would be like, well, but they're doing fine in school, or, but, and wouldn't necessarily follow through with what the parent may have been concerned about. There are, that is kind of where most of the research is in terms of why there is an increase in diagnosis. We understand it better. We're looking for it. We're looking very hard. And we also made the umbrella wider because we understood that a lot of people could benefit from services. And unfortunately, especially in the United States, you need a diagnosis often in order to be able to get services. And so there's also been so that policy also drives diagnoses as well.
So Sasha's heard about the lost generation, folks that were diagnosed later in life. They're asking what is driving some of that, this lost generation who wasn't diagnosed till later, and how do adults currently get diagnosed?
Yeah, that's an excellent question. So the advocacy of this lost generation is some of what's also led to us being more careful in taking people seriously and in looking more carefully. So it is true that higher functioning autism was not as well understood until relatively recently. So I'm, again, very lucky that in my professional life, this was better understood. And so that's kind of the way that I grew up professionally. But even like, I'm sure we can all think of cases even in our own lives where looking back, we're like, oh, this person probably would have benefited from help or services, but it was never identified. So we are constantly learning more. Like right now, a big focus is also on women with autism, for example, which often is diagnosed again significantly later. Adults currently can get a diagnosis of autism, and so there are people who do assessments for individuals who think that they might have autism. And so you can find skilled ASD assessors who have experience working with adults. The main thing is, again, since it's neurodevelopmental, we do want to be able to look at early development, and this can be trickier for older adults whose parents, for example, may not be able to be interviewed by us, or they may not have archival data. But whatever you have, we would a skilled clinician would be able to work with. So again, we always recommend, it's not uncommon, for example, for me to see a child and then the parents say, I've actually always wondered whether or not I have autism, and that's something that I want to explore. And so we do refer families to and adults to assessments as well.
Can you share why women are diagnosed so much less frequently than men?
Yeah, so there's actually been a lot of study about that in the past couple of years. And what the research shows is that women tend to be very good at what's called social camouflaging. And so they are very good at looking at other people and copying them, even if they don't completely understand like what exactly why. The difficulty then is that what we see often in women is a lot of exhaustion. So because you feel like you're putting on a front at all times. And so this is part of it because they're hiding it a lot better. So the median age for girls to be diagnosed with autism is actually 7 rather than with boys, which is a lot earlier. And so we, as an assessor, again, I tend to see girls later. So not even 7, sometimes more like 11 or 12 when they're starting to hit middle school and those social skills are really starting to take off. And their lag, they can't camouflage or fake it as much. And so then they start having symptoms of anxiety or social withdrawal, and people think that they're depressed or they're anxious. And then you take a closer look and you're like, actually, what's underlying it is the fact that they're working so much harder to try to get by.
Mm-hmm. A question from Austin was around how soon can parents tell that a child might be autistic?
So honestly, some parents can tell very, very early that something isn't quite right. And so, again, in my practice, I primarily work in assessment. And so I've seen thousands of families. And so I think I have a wider range than, than what normal people may see. And I see a huge range. Some family members, like from the date of birth, they felt something was off. They just didn't feel as connected. And then usually, though, you start realizing that something may not be quite right with development in the first 2 years or so, sometime in between there. And it's usually often because of missed milestones. Although some families do report that they notice things like not making eye contact or those kinds of things as well.
Someone's son here is 16 years old and he's never had many friends. When he was younger, he would cry in the park. He still doesn't have a ton of friends, struggles a bit with expressing feelings and struggles with writing. Something has struck her as that this is not super typical. Is there anything she can do to find out, or what would you recommend here?
Yeah. So as a person who does assessments, I'm always biased to suggesting assessments. A comprehensive assessment, especially for teenagers, can be really helpful because a lot of what you've described can be due to many different things. So, for example, there could be some anxiety. There could be some sensory issues that are getting in the way. There could be some speech and language issues, especially because, again, language is very abstract, but the most abstract thing we can talk about, other than time, is emotions. And so being able to understand what you're feeling and then be able to put them into words that is understandable for another person is actually quite hard. And so sometimes people are like, well, but he met all his language milestones and he was able to, do this and this. I don't think he has a language disorder. But then when we look at it in assessment, we're like, actually, he has these areas of difficulty that may not have been readily available readily visible. So with a profile that you just described with your 16-year-old, what I would suggest is to find someone who is able to do a comprehensive assessment to rule out an emotional piece, a language piece, as well as an academic piece, because the writing could also be, again, a disorder of written expression, for example, a learning disorder. So the main thing, again, is that we want your son to be able to feel good about himself and be able to express himself, and understanding where some of these things may be coming from can help him understand also how to advocate for himself.